Sports injuries are physical damages that occur during sports, exercise, or athletic activities. They are classified as acute, meaning they happen suddenly like fractures, or chronic, which develop over time due to repetitive stress. Sports injuries are trauma or injury resulting from athletic activities due to exertion, collisions, falls, or repetitive motions. Injuries are classified as acute, such as fractures and dislocations, or chronic, which includes tendonitis and shin splints. They can also be categorized as soft tissue injuries, affecting muscles, ligaments, and tendons, or bone injuries like fractures. Common causes include physical causes like direct trauma or improper technique, environmental factors such as surfaces or weather, and personal factors like inadequate training or fatigue, as well as overtraining. The first aid approach follows the Dr. ABC action plan. Check for danger, assess the response of the athlete, ensure the airway is open, check for normal breathing, and control life-threatening bleeding. The Rice technique is used for soft tissue injuries. It involves rest to prevent further injury, applying ice for 15 to 20 minutes, compression with an elastic bandage, and elevation above heart level. Signs of a fracture include deformity, swelling, intense pain, and immobility. First aid involves immobilizing the injury, avoiding movement, applying Rice if applicable, and calling for medical help. Soft tissue injuries present with pain, swelling, bruising, and difficulty moving the joint. The first aid involves applying Rice, avoiding heat initially, and seeking medical advice if the condition doesn't improve. For minor cuts, clean and apply a sterile bandage. For major bleeding, apply firm pressure with a dressing. Do not remove embedded objects, pad around them, monitor for shock, and call for help. Epistaxis, commonly known as a nosebleed, is the sudden loss of blood from the tissue lining the inside of the nose, often occurring in contact sports. Common causes of epistaxis include physical trauma to the nose, environmental factors like dry air or high altitude, and health conditions such as high blood pressure or clotting disorders. Management of epistaxis involves positioning the person upright and leaning forward, pinching the soft part of the nose, and applying a cold compress. Seek medical attention if the bleeding persists beyond 15 to 20 minutes. This video has covered the basics of sports injuries and first aid techniques. Remember the Dr. ABC and Rice principles when managing injuries.